My name is Wayne Lee. I'm an orthopedic surgeon. I'm also one of the ringside physicians, and I'm also on the medical advisory board. In addition, I also serve on the Association of Boxing Commissions, and I'm also a member of the Association of Ringside Consultants. And basically, it's an organization of ringside physicians, and we present cases about fighters, whether or not they meet requirements because of labs, this, that, and the other, whether we would approve a fighter to continue boxing. We always have to do a disclaimer. The pictures are not my own personal. Those were taken from Google. And so because this is being recorded, I have to make sure that people are notified about that. Let's talk about what the objectives are. From the physician standpoint, we want to promote a better communication between the contract inspectors and the ringside physician. We also want to provide an awareness to potential medical problems. And when do those occur? Pre-fight in the locker room area, since you guys are going to be in the locker room area, and then post-fight in the locker room area. Pre-fight, for those who've not done any time in the locker room area, it's very busy, it's very chaotic. It's a lot of things going on. There are fighters who are training. If it's a major promotional fight, there are television crews in the area, and you have to pay attention to a lot of different things. So it's important to sort of stay focused on the fighter, stay focused in terms of what the rules are, stay focused in terms of looking for signs to make sure that the fighter is in his best possible condition. So I'm going to run this, and the point of the video is basically kind of let you see that the back area is a busy area. This is from Chavez fight.
¿Está débil? Ya lo vi pelear. Está perfecto. Ok, mira. Así peleó. Se lo lleno. ¿Entiendes? Trata de agacharte un poquito más para que tú ya te lleves mucho más fuerza. ¿Ok? Tranquilón, todo va a salir bien. Estás aquí con te acuerdas que él pelea así, ¿no? Estás haciendo. Tú estás, pon tu guardia. Trata de eso, ándale, ¿entiendes? Pero sin bajar tú. Sí. Agarre fuerza y uno, los dos, que sean seguidos y luego el ganchazo, que es el.
All right. So the point was not to run the whole video, but it's to show a couple of things. One, you see that not only the fighter who's getting ready to fight is working out, you have people in the back that are getting ready to fight. You have also people warming up. You also have people getting ready. So you have people getting wraps, getting done. You have people who are already wrapped who are doing their workout before they get ready to get their gloves on to come out to fight. So there are a lot of different things going on. And if you're doing a major fight, you're lucky because it's an isolated area where you only have that camp and that fighter. If you're in smaller venues, you have 3 or 4 fighters going on, and there's a lot of things going on at one time. You got wrapping going on, you have fighters who are training, you have fighters with their seconds and everything else, doing things and getting the fighter prepared. So you have to really be observant and look at little things that are going on. And that's some of the things that we're talking about from the medical perspective. Because from the physician standpoint, we check the fighters pre-fight or the combatants pre-fight the day before to make sure they have signs of dehydration, to make sure that we've asked them questions as to whether or not they've been hit within the past 24 hours or within the past week and had a knockout. But a lot of times the fighter, because they want to fight, they may not give you that information. A lot of times they may have had a concussion, which we'll talk about, during their training that week. And I won't know, but there are signs that you see when the fighter comes in that may give you a clue that this guy doesn't exactly look right. Maybe we need to call the doc back to just have him check him just to make sure everything is okay. In your rule book, and it's page 31, and it basically talks about the responsibility of the contestants. And in that back section, on section O, it talks about banned substances. And it lists a lot of different things. Some of these terms are medical terms, and they say that the administration or use of any drugs, alcohol, stimulants, or injections in any part of the body, either before or during the bout, or by the contestant prohibited unless a drug is prescribed. administered or authorized by a licensed physician and the executive director. That's a lot of stuff. That's a lot of responsibility. And you're saying, well, what's a stimulant? We know what alcohol is. What are some of the other things? This is part of what we're going to go over, because there are things that are pretty basic that you would not think is a problem, but it's a banned substance. There are some things that the participants or the combatants do a part of their normal training that's banned. So if you don't know what you're looking at, they'll walk right in with it, and you think it's okay because you hear about it on television, you hear about it on the radio, you see it in the camps and everything, but you don't realize that the contents or the ingredients that are in those substances that they're using are banned. If it's a drug-tested event, everybody thinks everything is okay. Using the abbreviation, they popped positive on the test because they were using something they shouldn't have been using, because the fighter may not have known. We'll give them the benefit of the doubt that they may not have known. They may have known. But the point is, everyone has to kind of work together so that we can kind of make everyone aware, so that if the fighter was not aware, that we can point it out to him. If he is aware and they think that we don't know, then they know that all of us are aware, and we've been trained to identify those types of things. Let's talk about what's okay and what's not okay in terms of banned substances. These are pretty common things you see on TV. These are common things that everyone uses on a daily basis. Let's look at this. This is these energy shots, the 5-hour energies. Just a poll, do you think this is okay? No. Someone raise a hand. Why would you think it's not okay? Yes, sir. That's exactly right. That's exactly right. A lot of times people think that these substances are just vitamins, but you need to look at the contents. You look at the ingredients and see exactly what's in it to make sure that you're going to be okay in terms of, if you were drug tested, to be okay. Let's take a look at this 5-hour energy drink. It has caffeine, as was said, and it's a stimulant, so it's a no. But if you look at the ingredients, it does have vitamins, it does have sugar, it does have some of the other stuff, but you look down here at the bottom, it has caffeine. Some of these other substances, like the phenylalanine and some of these other things, may give a false positive if they're drug tested. So it's not our responsibility to sit there and tell all the fighters, you can't do this, you can't do that. But if you see it, then at least that way you can make them aware. The ultimate responsibility in terms of what the fighter is ingesting is on the fighter. It's not his camp, it's not anyone else, it's the fighter's responsibility. Pretty common, everyone sees it. Is this okay or not okay? Okay, someone else, why is it okay? Raise a hand and answer up for me. All right, there's no stimulants. It's pretty much sugar and electrolytes and some other stuff that pretty much is okay. So that's fine. If you want to be pretty straightforward, what's okay if you don't know? Water. What's the second most okay thing that you can use is a basic electrolyte drink. Gatorade, Pedialyte, or some of the other things that you see. Any of the other stuff, pre-workout drinks, some of this other stuff, unless the fighter has checked it, sometimes that stuff is not okay, because when you look at the ingredients, it may have caffeine. Okay? All right. The ingredients in Gatorade is what we talked about, has dextrose, sodium chloride, which is table salt, and some other ingredients, which makes it pretty okay. All right, this is a pre-supplement workout. If you go to the gym, you see people use this. There are a lot of other pre-supplement workouts, but I picked this one in particular because it's been in the news most recently. It's Jack 3D. You see a lot of people use it in some of the, not fight gyms, but in some of the workout gyms and stuff as a workout thing. Is it okay or not okay? If the guy had it already mixed in his bottle, but you didn't know because it's clear, but he told you that that he had it in there, or you heard someone in a camp say that they had it in there, is that okay or not okay? No. That's right, it's not okay. Not only is this is a banned substance, we talk about the ingredients. They have, again, caffeine in it, but they have some other substances that have been associated with some deaths, which is the DMAA. So the FDA has ruled it as illegal. So again, you may not know. I don't always know what's illegal or illegal, but a lot of times if the ref asks me, I can at least look it up online and I can kind of give you an idea if it's okay. But for the most part, if it's not water or electrolytes, it's safer to say it's not okay than to say it's okay and then run the risk of, again, we always talk about the major fights, but it's about protecting the fighter. You're doing a major event, they've had it, they test positive, and now we're trying to backtrack and say why it was okay that we allowed them to use a substance that we did not check and approve beforehand. Again, it goes back to the initial side, communication and everybody working together for the common goal. All right, let's talk about drug testing. That's not really a medical, but it falls under what we do. And as far as the drug testing, the thing that's important from the medical perspective is chain of custody. Because when this stuff goes through, the urine has to be collected. It's given from the fighter to either the physician or to the lab that's there or to one of you guys. So you have to be able to say, I had it, you signed off on it, you handed it to the other person that was collecting, that's responsible for it in terms of the agency. Someone needs to observe the fighter urinating. Because with drug testing, and it's unfortunate, the urine can be tampered with. It can be added, it can be someone else's urine, there's some other things that can be done to it. So chain of custody is important. Because when it comes back, if the urine is abnormal for drug testing, if the camp wants to push that issue or have an attorney, they say, well, who collected the urine? Did you watch the fighter collect the urine? Did you personally give the urine to the thing? Were you in the restroom when he was actually urinating? Well, no, I was giving him his privacy, so I didn't do it. Well, you really weren't sure whether or not the urine was tampered with during that brief period from the time that you heard something that sounded like he was urinating to the time that you were actually given the specimen. Does that make sense? So let's talk about, and I talked about chain of custody, and it's a legal term. And it's the chronological documentation or paper trail showing the seizure, custody, control, transfer, analysis, and disposition of the physical or electronic device. But in our case, we're talking about the urine. So it's a legal term, but for us, it talks about how the urine was handled from the time it was given by the fighter or the combatant to the person who's responsible in terms of the lab agency that's actually signing off finally for that particular substance. Let's talk about, and I've gone over this, urine collection, observe the collection. This seems pretty straightforward, same-sex collection. If it's a male fighter, you need a male person collecting the urine. If it's a female fighter, you need a female person collecting. All of these little things, you wouldn't think it made a big difference, makes a big deal, but it does. Because again, when it's time to be reviewed and it's in a legal system, all of these questions are going to be asked. So if there's not a female person present that's on the staff, then you have to get a designee. You have to sign off who that designee was. It shouldn't be, and it should not be someone from the camp. It should be a neutral party. And it needs to be documented in your paperwork somewhere on the side that this person collected it because we did not have a female person to go in at that time to do the collection, so that it's documented again, so that there's a record that shows the custody of that specimen. Because now you have someone who may not be a TDLR person who's handled the urine. So all of these things make a difference, and you have to pay attention to that. Because I said it's the little details that comes back when it's a problem that everyone says, I didn't really know. Make sense? Post-fight locker room. For the most part, the stuff in the pre-fight is not really a whole lot to talk about. It's just doing some minor observations. More times than not, those things that we just discussed are really not an issue. Where most of the problems come and where you have to be most attentive is when the fighter comes back from their bout. You know, they may have won the bout, they may have lost the bout. If they won the bout, their adrenaline is high, they're very excited. When we do the initial check at ringside, they say nothing's wrong with them. We check them and everything is fine. As things start settling down, they start having complaints of some aches and pains and those sorts of things. And so there are some things that we really have to be aware of to know to contact the physician so that he can come back and do a second check on the combatant. Let's talk about one of the ones that's most common. You hear about it in the news, and it's the one that, unfortunately for us, leads to the most severe end-stage consequences, and that's concussions. And we'll talk about basically what the definition of what a concussion is. A concussion is a minor traumatic brain injury that may occur when the head hits an object, a glove, or a moving object strikes the head, the mat, and it can affect how the brain works for a while. A concussion can lead to bad headaches, change in alertness, or loss of consciousness. Those are long-term consequences of the event that we don't see during the time, that we don't see after the fighter has left. That's days, weeks, and that sort of thing. But in the post-fight area, there are some signs that lets us know that there is something more severe going on and that we need to get someone so that we can further assess that combatant. So let's talk about the standard signs of a concussion. You see the fight. If you guys aren't watching the fight because you're in the back, if you don't have a monitor, you don't know if the guy was knocked out. If it was a minor knockout and he was out for a second or so, he says he's okay in the ring, we look at him, and then we send him, when I'm sitting there, when I'm on the side and I talk to him, one of the things that I say to him is, if you're having any problems, if you're having increasing headache, if you're having any weakness, if you're having any ringing in your ears, if you notice that you're having any problems with your balance or anything like that, let someone in your group come back and talk to us so that we can go back and do a reassessment. Sometimes they won't. But sometimes the only person who gets that is you guys in the back. Because you see he's not walking right. You see his balance is off. You see that he just doesn't look right. You see that, for the amount of time that he's had to recover from the other fighters, that he looks a little bit sleepy. He doesn't look quite sharp. Or if you're using that crosshair analogy, he's not centered, he's off in some way. And it's not asking you to be a physician, but it's just sort of like if you have children, or even if you have a friend. He doesn't look right the way I knew him before the event occurred. And so that's what we're talking about. So some of these signs are headache, temporary loss of consciousness, which typically will occur in the ring, confusion or feeling as if he's in a fog, and that's what they'll talk about. They'll say, I don't really feel quite right, I have a little headache, I'm just kind of dizzy or whatever. Those are some signs. Ringing in the ears, nausea or upset stomach, vomiting where they're actually vomiting, slurred speech. For some of the guys who've been here long enough, we've had some fighters where you've seen that in the ring. Fighter is okay, he got hit, he's sitting on the stool during the fight while the seconds are working on him, and you're listening to him talk, and you listen on the tape, and you see his speech is obviously slurred. That's a fight that has to be stopped. It's not because he has a big cut or something like that, but because of what he's presenting with, he has obvious neurologic signs that will put the fighter potentially at risk. If we're looking and we see that the fighter has had a lot of hits, if we see that something's going on, a lot of times what you'll notice is that we're constantly popping up, we're walking over on the side. What we're not supposed to do is interfere with the fighter getting treated during that 1 minute time period. So if we think that there's a concern, we notify or signal the ref so that way they can do a time at the conclusion of that 1 minute timeout. But if you had a concern, you say, I need the fighter to be looked at, you need the fighter to be looked at, then we'll assess him during that timeout. If it's during the fight and you think that there is something going on, you request a timeout. You ask the physician to come and take a look at him. You say, that I think that there are some concerns about the overall status of the fighter. Can you assess him? We assess him during the timeout. If it's in the locker room, it's the same thing. Someone comes and gets us, and we go back and check the fighter to see if there are any difficulties with him that we may need to have him sent to the emergency room either by ambulance or have him sent to the emergency room by himself or someone in his camp.
If you're in the corner and you see something like that, you advise the ref or y'all right away?
If you're an inspector inside of the ring, then what you're going to do is notify the physician. You're the ref working the fight.
No,
You're the inspector working the fight.
What he should do is call the referee over, tell him what his concerns were, what he saw. Then at that point, the referee will
Correct.
look at him, look at the situation, then contact you.
Right. Warning signs. These are those things that we talked about. They've become more pronounced. You have more vomiting. They pass out in the ring, but now they're sleepy, or maybe they may have even passed out again in the back. They're talking about a headache that didn't get better, and actually they're saying now that they have a headache that's gotten worse. Don't give them Tylenol, don't have the camp, give them Tylenol, get the doctor and have them come back and assess them, because it's not just a headache. Changes in his behavior or her behavior, such as irritability, changes in their physical conditions, such as stumbling or clumsiness, confusion or disorientation, or difficulty recognizing people or places, slurred speech again, and other symptoms which are more severe, such as seizures, or you see that one eye within the pupil is bigger than the other, which is, again, evidence of a neurologic sign. Difficulty with imitation or physical coordination. Those are things that should alert you that if you're seeing those things, you need to go get the doc. So that's part of everyone working together. And again, it's not making you the physician, but it's just like basic CPR or someone choking. He's like, this doesn't quite look right. I shouldn't really let him go. I need to get someone else to kind of sign off on him before he actually leaves. Lacerations. I mean, this is a broad topic, and I'm not going to really go into a lot of details about this, but for the most part, depending upon where we are, we may either suture these lacerations in the back, or we may send them out, or if it's a major fight, they may have a plastic surgeon on board, and they may do the laceration repair there. So it's something that, you know, it's kind of an open question. We know about them. Usually we will be back there with them to assess them and give them options in terms of what's the best way to have it handled in that particular venue. Nosebleeds, pretty straightforward. Example of a combatant has a standard nosebleed. When is it a problem? This is a cross-section talking about what generally happens. You have this network of veins and arteries that are inside the membrane of the nose, and typically most of the nosebleeds occur in the front. That's why this simple maneuver, such as just pinching the nose and tilting the head forward, will take care of most of it. But in some instances, it's way in the back. That's where they're getting a lot of blood. They're coughing up blood, or they say that they're swallowing blood, because the bleeding is occurring more in the back portion of the nose itself. If they're continuing to have a nosebleed and it can't be stopped, a lot of times, again, the physician, we may have something like Afrin or some other decongestants that we can squirt in the nose to kind of constrict that blood vessel so that we can get the bleeding to stop. Sometimes we have some of the clotting agents that the cut men have in their Vaseline that we can put in their nose to kind of help with the bleeding. But even if we can't get it to stop, again, it's a situation where we need to get them to go. But if we're in the front, we don't know. So if you see a guy where normally, and again, it's with experience, that you normally would have seen that the bleeding would have stopped, he's still walking around with a towel and it's full of blood, you need to get someone, so that that way it can be addressed, and that way we can get it taken care of and looked at. Cramping. I'm from San Antonio, so I had to put in this little disclaimer. I don't know if some people are other NBA teams, but, you know, this was my little side thing. Why do you get cramping? A lot of the mechanisms for cramping are multifocal. Cramping is basically due to overuse of a muscle, prolonged use of a muscle, but in the most common instance for us is dehydration. Not dehydration from the fight, it's dehydration from the day before. It's the fighters who are cutting weight. It's the guy who didn't train the month before, and he comes in with the plastic bag on, or he's been sitting in the sauna. He's lost 5 to 10 pounds the day of weight of the day of weighing, and then he comes in, he does his fight, and we're watching him during the event, and this guy's not sweating, or the woman's not sweating, because they don't have that additional volume to allow them to cool themselves off. So they get out of the ring, they're okay. Still have their adrenaline going, they're doing pretty good. They get in the back, they're on the floor. Or if it's an MMA event, because they've gotten kicks to the leg or something like that, they can't walk. Again, it's one of those circumstances that don't let the camp say, it's okay, we'll take care of it. We need to be able to go in the back, assess them, make sure it's not something more, because they may need to get IV fluids, or we may need to send them to the emergency room so that they can get IV fluids then. Make sense? All right, we talked about common causes. Like I said, the most common cause in our circumstance is dehydration, and that's why the electrolyte replacement is important. Some other factors, but this shouldn't apply to most of the combatants because they're pretty young. But there are certain blood pressure medicines like hydrochlorothiazide or some of these diuretics that you use for blood pressure control can cause you to have abnormal electrolytes that can cause you to have some cramping. If you have certain cholesterol meds, it can cause you to have cramping. So that's not anything that you need to know, but when I'm doing my pre-fight evaluation, I'm asking them questions about if they're on these certain medications. So that allows the physician to check them and keep an eye on them during the course of the event. All right, and we talked about the treatment, hydration, and that's why if you see me in the back and we're talking about and we're asking them to drink, and that's twofold. Because again, if we're doing drug testing, if you've ever seen a major event and you're trying to get urine, it takes forever because they're dehydrated. If you've ever seen a major event and you're trying to do urine collection, it's bloody because they're dehydrated. So a lot of times, as soon as they get back there, encourage them to drink. Get some water. You know you're going to do a drug test, drink up, so that by the time we get there, we're not waiting until 1, 2 in the morning to try to get urine to do a drug test. Encourage them to start hydrating as soon as possible. If they lost and they're upset, okay, keep pushing the bottles in front of their face. Keep drinking so that way you can get them hydrated. And it helps their kidneys because it's not normal for you to have all that blood in your urine. That's from all the punching and blows and stuff that they had. They drink, it clears out their kidneys, and that way they don't have any long-term problems from that. Again, starting out, this is at a weigh-in. Cooperation is important. I'm not here to stop anything. I'm not here to prevent the event from going on. My primary concern, and all of the ringside physicians here at TDLR, is to make sure that the fighter and that the environment is safe. And the only way we can do that is if everyone works as a team. If I get information from you, I can make better decisions. If I get information from the camp, I make better decisions. And the decisions that I make keep us from having catastrophic events on the mat. Because everyone wants to fight, but no one wants to walk around with a, post-concussive syndrome or having a worst-case scenario when someone dies in the ring. So if everyone works together, it doesn't mean that we necessarily can prevent it, but we sure can do a lot of things to kind of decrease that likelihood from happening. Thank you very much. Questions?
The first one is regarding urine collection. I know in drug treatment, drug rehab facilities that they make the person urinate in front of them to the point where they must watch it exit the body and hit the cup. And if a finger hits the urine stream or goes into the cup or there's any other sort of tainting, they dispose of the cup and they make them start over again. While it's a little uncomfortable for probably both participants in that, is that something you recommend for us?
I think that at this present time, we do not have a rigid collection policy. But what I am doing is giving you a general collection policy in terms of specimen collection. Now, for events like if I've worked that there were strict drug check, you have to sit there, watch the person actually void, watch them actually in the area while they're voiding. Make sure there's a temperature probe on the urine to make sure that the urine temp is body temp. Depending upon the agency that we use, there may not be a temperature gauge on the cup. So when I say watch, I'm pretty much meaning you need to be standing in the general area. There shouldn't be a closed door. You should be seeing them actually urinating, giving you the specimen, because it's a drug test, because the test can be tainted. Let me give you an example. There are devices that you can strap on that has a catheter tube, and they can go in and look like they're urinating and get urine from another source. Sometimes people are not, they get it from their girlfriend. They didn't know their girlfriend was pregnant. No, I'm giving you a true example. They didn't know their girlfriend was pregnant, and they test for a pregnancy test. They do a pregnancy screen on the urine, or they test for hormones, and it's like, why? You're a guy. Why are you pregnant? So there are things like that. Or the urine was put in, the camp had the urine in the ice chest. They know their guy uses. They're like, oh, we're going to go ahead and give him the urine. He straps this thing on. Oh, you need to get the urine. He goes in the thing. But the urine is 37 degrees or 22. I mean, it's not Shinerbach. You know, it's supposed to be 98. So that's why they have the temperature on the cup. So again, there should be some general due diligence, at least on our part, because the more we're able to do things in terms of actual collection, if there's an adverse outcome from the urine, then at least we've done minimal due diligence. We watched them. Did you watch them collection? Do the actual voiding? Yes, I stood there on the side. I'm not there actually gawking, but I'm standing there watching them. It was not a closed area. It was an open area. There was no opportunity for something else to be done. She was in the restroom. She did the collection. The female TDLR representative or the surrogate saw that there was actually there, and there was no gross opportunity for something else to happen. So that crosses that out for someone saying, well, there was a period of time when the combatant was not viewed directly that something else could have happened. Does that make sense?
Yes.
Okay.
So my second question is regarding first aid.
I'm sorry, I didn't hear, regarding
First aid. I have seen referees, for example, if somebody was submitted or got knocked out, try to help revive the fighter, for example, by lifting their legs up in the air, or arterial bleeds where they put their hand on it and try to stop the bleeding, concussions to the point where somebody starts having seizures and they lay on the person or lift their head up. What is your recommendation to officials and inspectors in providing initial first aid or working with you guys, or any sort of recommendations you have for these groups, please?
You're in an environment where you have other people who have a higher level of expertise. So to assume and start doing treatment when you have someone else there, puts yourself and puts the state at risk. It's not like you're on a highway and you see someone and you start doing some things. We have physicians on site. That's why a lot of times we have 2 physicians on site. It doesn't take 20 minutes to go from the front to the back to get someone. If they're seizing, it's still enough time, as long as they're lying flat, for someone to watch and make sure that the person, the combatant, is not injuring themselves. You don't have to stand on them or anything like that, but it's still enough time for you to run, get someone, have a physician come to the back, have an EMT person come to the back, so that medical care can be rendered. I think it exposes you to do treatment that's not the standard of care. And it would be the same as me trying to work on a car and I don't know what I'm doing. So I think it's best, because you have someone on site that can help you, that you rely on that help. Next question.
We are concerned about the pregnancy tests that are being done at the weigh-ins. We've had false positives come up. Do you have any recommendations?
False positives?
Yes,
I don't
where
know
we've had a test given with one of the inspectors there, it shows positive.
Then it's positive.
While when they did the second one, it came up negative.
The current pregnancy tests that are out are about 99-point-something% accurate.
Okay.
So if a woman pees on the stick and it's positive and the second is negative, then I would do one more. But that first one, I mean, that test should be positive. If it's positive, it's positive. I mean, I don't know about it being false.
Yeah, okay.
I mean, you see what I'm saying? I mean, that pregnancy test is fairly accurate. I mean, it's just as an aside, I mean, it's just like when I go and pick up tests just to have in my bag. I always get the look, I'm picking up 10 tests
Yeah.
at one time to carry in my bag to go for things.
Player.
Those tests are fairly accurate. And, you know, you're more concerned, you can be very early in your pregnancy, within the if you're within the first month, you may get a false negative. You see what I'm saying? Because your hormone levels aren't high enough for you to read positive. But you're not going to be in the same setting where you're going to urinate a positive and then turn around with another urine specimen and come back negative.
Okay, our other question is, can the male inspectors, TDLR employees, or our contract inspectors, can they perform those tests, or does it have to be a female with these female
Well,
participants?
let me put it from the standpoint of from the medical community. When I examine a patient that's a female, I have a female in the room. I have my nurse in the room. I have someone else. It's not to say that anything goes on, but you don't want to expose yourself in circumstances where, say, down the line, then they say, well, that guy was looking at me funny, or, that woman was looking at me funny, or this was going on. And so now you bring another element that you don't need to have. So that's why I said I realize that the number of women TDLR agents are small. That's why I said you get a surrogate. I mean, because until we get the numbers up, and that's what I do. Because when I'm collecting these urines on the women for pregnancy tests, I try to find someone not in the camp. I get them. I say, this is what I want you to do. I have them go in and do the test. They come out with the stick, and I write it down, but I write that it was observed by someone else. Because I just can't, you just don't need, that's just from practice. You just don't need that other level of exposure, and you just don't want to get into some stuff. Because like I said, all it is one time. And then it's like, well, what's your policy? So until we have a policy enacted that it is okay, or that we put in our contract that it's okay that we do have mixed gender doing the testing, then that way we're covered. Otherwise, we're not covered. Question?
Doc, you talked about hydration, dehydration. I just want to know, what are your thoughts about the use of IVs after a weigh-in?
No. That's a medicine. That's basically what the camp does privately, we have no control over. So on these mega fights, they have their private doc with them. They go back to the room. They get hydrated. If I don't see it, I don't know about it. But for us to sit and sanction it, we can't do that. The rules don't state that that's a violation. It's a violation it's a violation as far as I'm concerned, because if the person doesn't know how much fluids they're giving, you can cause some medical problems. If they are 2 liters or 2 bags behind, maybe they shouldn't fight, because then you're giving them all of this fluid, then they can get fluid shifts in the brain that can cause them to get brain swelling. Because if they've that dehydrated, then they're dehydrated in the brain, and so when they have a head injury, it's a little bit more severe with them. So it needs to be monitored. That's what I'm saying. If I see it, I'm going to mark it. I'm going to let Greg know. But in terms of stopping something, I really can't, because we don't have anything written. If it's something that the state is concerned about, then when we go to medical advisory committee, maybe it's something that we need to bring up in terms of actually knowing that they're getting IV fluids pre or post fighting, that's not okay unless it's done by a physician and they sign a waiver. So again, we don't get responsible for that.
So as an inspector, a doctor can't intervene on that minute. The doctor has to wait till after the minute and then call the time, for the ref have to call the time? Or how does that work? I don't.
When we're training people, what we tell them, and what's pretty the standard across the country, is the fighter should be given the maximum amount of time to recover. If we're going in and intervening, he doesn't get his full time. He now is at a disadvantage, because the cut men can't work on him. The people who are supposed to work with him can't work on him. The person who's trying to give him some advice from the last, from the round, from what they're seeing he's doing or not doing, they don't have that time. Unless the guy is really falls out unconscious, slurred speech or something like that, that's going to be a stoppage of the fight anyway. So that's different. But if it's something that there's a question, you pass it on, let them do what they're going to do in the ring, we call time, then we inspect the fighter, and see what's going on at that standpoint.
Something on that same question, Dr. Lee. I think what was, if it's it's the fifth round, it's going, the fifth round ends, the minute starts for their minute break. You walk in, what the referee's supposed to do is call timeout, because that contestant is going to get the full minute to work on that guy. So you come in, you consult the referee, he's good to go. Then the referee should turn to the timekeepers and say, time in.
Well, what I'm saying, though, and that's what you see when we have, and that's why when we're training the new docs, they're quick and they want to go in right at the minute, and they're all in the way of the seconds and everyone else trying to work with the fighter. And so we're telling them, don't interfere with the fighter while he's getting care. You address your concerns, and if you see us working, if you see the senior people working, you see us walking around on either side while they're taking care of them, we're taking a look, and then we're doing this saying we want a time afterwards, and so afterwards the ref will call time, we go in and do a more thorough inspection. Now, talking on our side, bad practice is time is called and say someone has a bad cut and we're treating. We're not supposed to do that. Where you see someone putting a whole bunch of pressure, acting like a cut guy to do the wound. We're not supposed to do that. That's not what we're there to do. We're there to inspect the wound and give an opinion. So if the guy's bleeding, I'm not supposed to go there and put a bunch of pressure. I'm supposed to just dab so I can see, make sure I'm not seeing an active bleeder going, and make a call at the time. Depending upon the location and the depth of the wound, which I didn't go into because that's a more technical presentation, but that's what the physicians should have expertise and training to know based on the location, based on the depth, based on if they see an active bleeder, they make the decision to say that this fire cannot continue. Not treating. If the fight, and so when we are constantly asking for a time when someone has a cut, I'm looking at progression of the laceration, whether or not there's so much bleeding, even with the cut person working, that it is physically obstructing their view. If it's obstructing their view, then they can't adequately protect themselves. So then the cut may not be any larger, but if their cut guys aren't that good, I may say he can't continue from a medical standpoint, because if he has so much blood coming down, he can't see. So it puts him at further risk to get a head injury or some other things. So we're making some recommendations based on clinical judgment, based on what we're seeing. So that's why it's important for the docs, and that's why I said I'm talking about us now, that we're paying attention during the course of the fight. It's two guys or two individuals, a woman or a guy, whoever the doctors are, and I'm only responsible for looking at that guy. I'm watching him the entire fight. I'm looking at how he's doing during the fight, how he's breathing, how he's recovering, because that lets me know how conditioned he is, whether or not he's going to make 12 rounds. I'm checking how many hits did he get during the fight, because even if he completes the fight, but he got a bunch of hits and he didn't get knocked out, I still may send that guy out because he got a lot of head trauma, or he may have had a lot of facial swelling that may later on several hours cause some difficulty. So the fighter may look okay, but I'll see him, I said, he's taking a lot of hits and he didn't get knocked out, but from my clinical experience, I may give him 90 days. He may get 60 days. He may get the same time out for suspension as someone who had a KO or a TKO, although it may have been a 3-round or 4-round bout. So that's where our clinical judgment comes in terms of helping the TDLR official best know what their suspension time should be. Yes.
Back a little bit. IB. Okay, next week I have a weigh-in, and I see a doctor leave with an IB, and I say no. What about if one of these fighters die? It come on my shoulders?
No.
Because I say no?
Does it come on your
When the
shoulders
doctor
if
say
you
yes?
allowed it to go versus not allowing it?
When the doctor say yes?
What I'm saying at this point is, when you go through the rules, we do not have any rules saying that you can, that IV fluid administration pre or post fight is prohibited. So until we have that in writing, if they're giving IV fluids, it's not on the state. If that guy got IV fluids and he got a bunch of IV fluids after the weigh-in, and this guy seizes, that's on the group. That's not on the state. That's not on the state. Again, I'm trying to give the medical. I can't speak for the state in terms of what their policies are. What I'm saying is, from a medical perspective, if I see it, I can't go to Greg and say, this fighter is disqualified because he got IV fluids. I know because the fighter got IV fluids at the weigh-in, I need to watch him because he may seize, he may have some other problems, some other things may go on at the time. Yes.
Okay. Dr. Lee, hi.
Yes.
I wanted to point out that right now, the only prohibition that we have before a bout is that a contestant can't have the administration of a drug, alcohol, stimulant, or injection. So I think what Dr. Lee is saying, that if you see that happening, that is not a violation of our rules. So you don't have to stop them. If
Right.
they continue with that IV and something happens, that is not a state responsibility, and it's certainly not a responsibility of yours. Unless we amend the rules to include IVs.
Yes.
Okay, thank
And
you.
So some coaches use vitamin B12 injected. If we see that in a fight, it's being administered in, like, let's say in the dressing room, it classifies as an injection. Is that illegal?
Yes,
Okay.
We've specified injections,
So the injection is,
but it's not a one-time,
so a one-time shot is illegal.
yeah, at least right now in the rules.
Okay.
So,
Because the
it's-
substance itself is not banned.
Right. That's why I was
Right.
asking.
So the substance is not banned. The route of administration is what's banned.
Okay.
Right.
Thank you.
So
And
that's why I want to make sure.
I think the rules also say that if you're going to take an over-the-counter drug, you need to inform the executive director 24 hours. I'm guessing B12,
Well, B12 doesn't fall under as a strict drug. B12 falls under as an over-the-counter. It's a supplement, so it falls under supplements. So that's why when I was saying the stuff about the one-shot energy drink, the other components, which are B12, B6, and some of the other vitamins which give the combatant some energy, is not listed as a banned substance. It's not listed as a banned substance in the anti-doping. It's not listed as a banned substance by the Olympics. But the route of administration for us is.
right.
So if the guy comes in, he's chewing on a B12 tablet, that's fine. But if he's getting a shot, that's not okay.
That's correct. And that may be something for the medical advisory committee to discuss and say, do we need to make some changes in the rules and sort of fill in this discrepancy between, say, an IV and injection and be more specific.
Okay.
The difference would be is, okay, you're talking about after the weigh-in, okay, and they take that injection, they could be drinking some liquid after the weigh-in.
If they did liquid B12, it's not a problem. If they
Okay,
did an
but
injection.
the difference is, are they doing it out there after the weigh-in, but no such thing should be allowed in the dressing room?
It's
like
not
you were saying.
banned.
No, but still, the injection,
The
then
injection,
everybody's going to be...
if they're getting an injection, period, it's banned. They can't get an injection. Pre-fight, post-fight, they can't get an injection.
Okay, good.
If they do it in their locker, if they do it in a hotel and we don't see it, that's on them. If it's something that the official observes, it's a violation.
Good.
And
Thanks.
so that's why we have to go over, and that's why when I started, I made sure I put the rules up so that if we're following the rules, it's not a problem. It's the same as, notifying you if you have a med, because there's a fighter in the pro ranks that fights here in Texas. He has exercise-induced asthma. It's okay for him to use his inhaler before he fights. He can have, one of his people can have the inhaler, he can get a hit, not a hit, but take an injection with the, sorry, take the use of the inhaler and go ahead and participate in the bout. But then the inhaler goes to the physician. They can't hold the inhaler during the course of the event. That's okay. I mean, we didn't talk about some other things that are current, things that are going on across the country in terms of people who are on steroids that have medical waivers and those sorts of things. So there are other things that fall under this pre-fight, when people are coming in and when we're doing exams, that all of that stuff starts coming out, but you have the answer with your book. And it's pretty straightforward. Yes?
Dr. Lee, I just wanted to clarify on the the rule that talks about the administration of drugs and stimulants and injections does say either before or during a bout. So, I mean, after the bout, I don't know that we really necessarily care. But as far as the rules,
So
are concerned,
it says when?
it says either before or during a bout.
That's what the rules say.
Yeah.
So after the fight, if they're in the back and they get an injection, it's okay.
Our rules don't address it. Let's put it that way. So.
Here's what I say with that. See, then it goes, it's just easier to say no. Because unless you know what's in the syringe,
Yes.
I don't know what's in it. Unless I have the vial that shows what it is, because people come from all over the country. They'll have a pre-filled syringe and say it's B12. I don't know what it is.
Yeah, that's true. Yes.
So then you have to start doing exceptions. If they have the vial, that's the rules, okay.
Yeah.
If I don't know what's in it, I'm going to say no.
Okay. So, but I just want to clarify. Right now, the rule just says before or during. And so
The
what it
rules-
addresses. We may need to discuss.
We may
again
need to
in,
discuss post,
Yeah.
so that way we're covered.
Yeah. Yes, sir.
Okay. Is it illegal? Yes. What part of it is illegal? The injection. Is the actual IV illegal? Then we can start talking about, is the IV fluid considered a medication? In the hospital, it's a medication because you can't go in the store and buy saline. You can't buy a bag of saline at Costco. So technically, it's a drug. So if you really want to go and look at the fine points of it, a bag of IV fluids is a drug because you can't go in a department, you can't go in a pharmacy and pick it up in the United States. So whether it's injected or not, you need pretty much a prescription to pick up a bag of saline. You don't need a prescription to pick up a bottle of Pedialyte. You don't need a prescription to pick up a bag of electrolytes. So whether it's injected or not, it's illegal. So unless they have a prior approval that they need to have an IV fluid, it's still illegal. Because it would still come back to us to see whether or not it's something that they need to give. So just arbitrarily giving it without, it still falls as a no.
If a fighter's getting, let's say how he said that we don't ban it after a fight, but if a fighter's getting an injection after a fight, he's going to be with other fighters that haven't fought yet. So how will we know that that trainer or the doctor is going to, give it to some other fighter? So wouldn't it just be a no all around while in the locker room, or, you know what I mean?
I think at this point, we're saying no. I think what this has shown is that there are some points in the rules that need further clarification. I think that that's the good point of having a forum and a seminar like this, is that it points out, because you guys are actually doing it day to day, you see what's going on, and it lets us know that the way the rules are presently written, it doesn't cover some of these details that are being brought out. So that means that this is something that we really need to address, on a fast track, so that way your questions are answered. I know it's warm. Thank you very much. Have a good rest of the day.